Hello, good evening. Welcome to What Med Media. For those of you who are new to the page or the channel, I'm Dr. Kish and Reese, and in this special surgery, firstly, before I start, I've got to give a very big shout out and a thank you to Liz, who runs the BRAP courses that pharmaceutical physicians go on. You'll see some of them up in the corner. I can't quite get it right because it's mirrored, but right there on the top of my shelf, Liz organises that course for pharmaceutical physicians undergoing training in industry, which is really useful at the moment, right, in terms of the world of following the science and understanding what is going on in this COVID world, which is, quite frankly, petrifying. What I'd like to do, what I'd be really keen to do, is make sure that we kind of cut through the pseudoscience. We share with members of the public at scale and largely and kind of significantly real science, real practical tips, information and helpful advice, because unfortunately there is a power vacuum. Sorry, an information vacuum, not a power vacuum. There's a different kind of vacuum. There is an information vacuum, and unfortunately what that means is patients, people, members of the public feel powerless. They have absolutely no control over the situation, and they also make stuff up, and social media make stuff up to fill that void. So 34 people watching. If anyone of you feels that you are powerless in that situation, please do comment, please do let me know. And the reason that Liz is getting a very special shout out is because I had a catch up with her. She acts as a very much of a mentor and sort of trainer and teacher, and I had a catch up with her, and she said to me, Kish, did you listen to the PM programme a few days ago? It's actually on the 22nd of April. I said no. And that's why I've checked in to BBC Radio 4, because I'm about to borrow some of their content, which is very kind of them. But we're all licensed payers, so I'm sure they won't mind. And given the fact that it's a global health pandemic, I think it will probably be okay. And the reason that I'm going to share this with you is because friends of the page and subscribers and part of the What Med Media community will know that back in the early days of this, and I take no credit or pride, in being right on this early, but I think it's important to emphasise the point that early on I said, mid-March kind of time, that one of the most useful things that you can do is to go and buy a pulse oximeter. And for those of you who remember it, some of you may well have gone and bought it. Evan Davies on the PM programme was very keen to say that he didn't want to cause a run on these, and nor do I. But interestingly, we're going to play the whole clip of this because I think Richard Leviton, who's a New York medic, goes through it in such great detail. He's a really experienced clinician. He's been working for 30 years on the front line in New York, which is an epicenter outside of Wuhan for this disease, right? So his words are really, really powerful. So this is going to be quite a good surgery for me in the sense that there's an 8-minute clip. I'm going to play it because it's disseminating. It's using my platform and the profile that we've got together that we're building, which we've reached 1 million people, to get that core information out to the public, all right? And also that's going to up your understanding of COVID-19, coronavirus, COVID pneumonia. So basically you are better equipped and prepared, and that you are safe, right? So what I'd really like you to do is if you could please share this, invite your friends, I'd really appreciate it. I'm not going to go through comments yet because I'm going to get straight into the meat of this, which was the clip that I've got isolated from the Today programme. This was broadcast on the 22nd of April, so a few days ago. And Dr. Richard Leviton, who's an experienced A&E physician of 30 years, talks through his experience of managing COVID pneumonia, as he puts it. And there's lots of practical tips that members of the public need to be aware of. So just have a little listen.
Prompting a COVID-19 test. They focused on giving X. In truth, we felt extremely lucky to have these early days to ourselves without the intrusion.
This is just the last little bit of the segment, so it's about 10 seconds. Just bear with it. If you can hit share in the meantime, it'd be really helpful.
That sometimes the hardest of times bring the sweetest rewards.
Ellen Roberts, second COVID Chronicle. Good luck to her and her daughter. Now, as time progresses, we learn more about how the disease, COVID-19, affects people. And some of what's emerging is unnerving and intriguing, in particular its effect on oxygen levels in the blood. Now, Dr. Richard Leviton is a professor of emergency medicine. He's worked in the field for decades and spent 10 days working at Bellevue Hospital in New York during the surge of COVID-19 cases, and joins us now. And Richard, you wrote a very interesting piece in the New York Times about what you had seen. And maybe you can just tell us what you saw in patients with the kind of pneumonia and oxygen levels that went with COVID-19.
So what is so extraordinary about this disease is that while oxygen levels fall and they fall slowly over the first few days that patients develop COVID pneumonia, that they are still able to breathe out their carbon dioxide, and that they actually don't have symptoms of shortness of breath despite developing serious pneumonia. And their oxygen levels go to shockingly low levels. So patients would present with oxygen levels of 50%. Normally, 94 to 100% on a pulse oximeter is what we see in people at sea level. And these people are presenting with oxygen levels that match those found in climbers at the top of Mount Everest.
Right. So this is some are saying it's more like altitude sickness that you're seeing than pneumonia, at least in the early stage of the pneumonia phase.
Let me be clear. This disease is not altitude sickness. It's not caused by the same thing. What happens on the top of Everest is low barometric pressure, which causes a response in the arteries that go to the lung. This disease is killing people because it causes inflammation, specifically in the area of the lungs that produce surfactant and help keep our lungs open. So although there are many physiologic responses that happen with COVID pneumonia that are similar to altitude illness, the disease process is different. But basically, humans have one response to hypoxia, and that is to breathe fast. And that is what these COVID patients do early, but they don't feel short of breath early in the illness.
Right. So can I just be clear? So some of these patients you're seeing with this hypoxia who are breathing fast, who have low oxygen levels, these are not the classic COVID presenting patients who wait to the 10th day, who are beginning to really get breathing problems and show up at emergency wards. This is something that is affecting people earlier, and not just the most serious cases who potentially go into ICUs.
Right. Let me share with you, one of the saddest messages I've received after my article came out. It was about a person from Spain who was monitoring his wife who felt poorly. They had a pulse oximeter, but the message that they got was to return only if there was shortness of breath. They monitored her oxygen. It went into the 80s for days. And then after several days, and she was watching television, she said she felt fine. But after several days, her oxygen went down to 62. She arrived at the hospital.
I've had a couple of people saying they've lost me, which is a bit of a shame. I've just paused it and the numbers are dropping off, so maybe it's just died. Can somebody else just say whether they can see and hear me? Castano, can you hear this? Buffering, lost you. So it might be signal problems. Sorry about that. So we might have to try that again with 4G. I'm going to plough on. If the viewers plummet, we'll just do it again. So let's have a look. Hold on. Where is it? Oh, no. There we go.
And sadly, she passed away after being put on a ventilator. But had she been treated in the 80s, had we detected early low oxygen, I believe, she could have done much better. And right. I know this from examples of emergency physicians who detected low oxygen earlier. Even 92%, 90% got treated and did very well with minimal interventions.
So that is, and she didn't feel she was having difficulty breathing because her breathing was undoubtedly accelerated because she was short of oxygen. But to her, she was able to breathe normally and had not clocked the way it was affecting her.
I've heard directly from her husband. She felt okay. She had no trouble breathing.
Amazing.
Her oxygen levels were falling dangerously low.
Right. And one particular outcome of this, and I'm scared of causing a rush on the purchase of them, but is in households where someone has COVID, it would be useful to have an oximeter to detect the oxygen levels, because if we're not very good at judging how badly it's affecting us, you better have a device that is going to read it and tell you, right?
Well, so, pulse oximeters are available in consumer models. They're available, in healthcare systems. The one we use in healthcare systems are not the same as the consumer models. If you buy the consumer models in bulk, thousands of units at a time, they cost far less than $1. But what I am suggesting is this is a long fight we are in for. We are fighting a respiratory pandemic that attacks the lungs, that silently kills by lowering oxygen. Over time, I believe the world will be better served if we think about pulse oximeters the way we think about thermometers for home monitoring.
That's really, really interesting. I mean, have you got any... What would you recommend for a patient in that position? So the oxygen's gone down to, say, 80-ish or 85% or something like that. Would you recommend... You wouldn't put them on a ventilator for that. I mean, actually, one of the curious things is ventilators seem to have been used much less than we had anticipated. You would just give them a little bit of extra oxygen? Is that how you do it?
I basically feel that every American, everybody in the UK, should get the same care that Boris Johnson had. Close monitoring of pulse oximetry, early hospitalization if oxygenation falls, and then oxygen administration correctly without a ventilator, and they will do well. I think the vast majority of COVID pneumonia patients do not need ventilators. We have scared the heck out of the public that everybody with this disease is going to get put on a ventilator. The reality is there are probably 10,000 plus Americans who have had COVID pneumonia and never even presented to hospital because it so silently impacted them. I saw patients at Bellevue who were stabbed, and we were checking for a collapsed lung, and they had no complaints related to their breathing, and we find, they don't have a collapsed lung, but they have COVID. So there are many asymptomatic people with COVID pneumonia, but there are also the vast majority of patients who present to hospital with COVID pneumonia have come in very late. And I believe that the widespread use of pulse oximeters will move the treatment window to an earlier phase where we can have outcomes that Boris Johnson and others have had.
That is so interesting. Look, just finally, do you have any evidence? Do we know whether the disease does long-term damage to the lungs?
I can't answer that. I wish I could, but I have, I know of many emergency physicians who have had it, and, with their recovery, they feel much better.
Right. Fascinating. Really fascinating.
So, 69 people watching. I'm sorry there were some technical difficulties for some of you on that in terms of sound dropping out and various other things. It's probably because, like the rest of the UK's broadband network, is heaving under the strain at the moment. So just before I go and get something to eat, which I said that I was meant to do sort of like 45 minutes ago, but then this came in and I felt we had to do the broadcast because it was important, and if I didn't do it immediately, it would probably get lost and not happen. If anybody's got any questions, please let me know. No sound, that's weird. Working now, good. Okay, so some of you it's working, some of you it's not. If you're having problems, what I would suggest is that it will be available afterwards on the page as ever, and once it's uploaded, you should be able to watch it. I'll also work and get the video on YouTube, so it'll be there as well. I'm not sure that there's many questions. I saw one comment where there was something about people were saying that, this looks like it's a normal day. People are out and about, and certainly I have seen instances of that. But I'd be keen to hear what it's like in terms of in your area. So if you could comment in terms of tell me where you are, what the problems are. Slow down the subtitles, please. And they're auto-generated. So this is Facebook, which is good because I don't have the resource or the time to subtitle my content, but I think it's really important. So maybe I could talk a bit slower and the subtitles might be slower then. But yeah, that's an auto-generated thing from Facebook. 49 people tailing off. I think I'm going to go and eat, right? I've had a long day at work. I did get up this morning. To be fair, I did my bike ride. I had an 8 o'clock call. So I was up at 5, I think. Then I left at 6 and did 6 till 6:45. No, 7:45 cycling, which was good. maintaining a distance, which was very easy actually, because there was nobody out in the cold and the rain, which is surprising, isn't it? All those people that wanted to do exercise in the sun, a couple of days of rain, and they're not there. Traffic is heavier, I agree, but you know, the people that were in parks, exercise was so important. It's funny how they're not there, and I think, you know, that one of the best things that could happen is this 10-day period of rain. I did buy the papers. I was going to do the paper review as well. They're all downstairs, so I might have to do today's papers tomorrow. But I did see the front page of the Telegraph, which was something about, it said the rain has done the job that the police couldn't, which was keep people indoors, right? But it was a horrible job for the police, and I'm not criticising them. And I think we need to support them, and they need to be supported in the work that they're doing. But when the weather does break, I think we need to be really, really aware that we are dealing with an absolutely horrendous respiratory disease that is causing new problems in new ways that we're not sure. So I don't know if you saw yesterday, but news broke that it in children presents with a Kawasaki type disease presentation, which is basically children getting rashes all over their skin. Haven't read into it massively, and correct me if I'm wrong, anyone that's watching, but I believe PC Roan, I believe that it's a vasculitic type picture, which that means an inflammation of the blood vessels in the skin. Also, there was a report from New York where, I mean, it was reported by The Independent, and it was terrible. It was a typical clickbait title. So I don't think I shared it, but I definitely screenshotted it. And that was horrible in terms of saying something about somebody's heart exploded, right? So the biggest thing that you guys that are watching can do to help this is basically, if you hear somebody saying that they don't have, if you see somebody and they're saying that they don't take this seriously, or it's just the flu, or it's an overreaction, oh, it's a 5G conspiracy, oh, it's this, oh, it's that, just tell them that it's ridiculous. Tell them that it's absolute nonsense. And they need to start taking it seriously, because what we need to move towards is a society and a model where as the advertising campaign says, right, at the moment, anybody, act as if you've got it, anybody could spread it. So I would say it's better late than never that's come out, and that's a message that really needs to be rammed home to the public. Also, other little practical tips that you can do to prevent the spread is wear face masks. Just like What Med Media was ahead of the government advice on pulse oximeters, there isn't actually government advice on pulse oximeters yet, but just like the audience of What Med Media had that knowledge, that vital knowledge about pulse oximeters being useful, other countries around the world are suggesting using face masks. To report on it in a fair and balanced way, others aren't, okay, such as Sweden. Their pubs, bars, clubs, etc. still open, right? So I think the take-home messages for this are, it is a marathon, not a sprint. We are in it for the long haul. We have had quite a good coordinated response in the UK from industry helping out. And by that, I don't just mean kind of healthcare, health technology and pharma. Obviously, I'm closer to that, so I know about it. But also British Airways, right? One of my mates who works for British Airways, I won't name him because he messaged me privately. But he sent me a photo that I said we could. He said we could share. They did a 26-hour flight to Beijing, where the plane was literally full of PPE and equipment. Right, so that's fantastic. That is brilliant. Unfortunately, I did see in the news today that BA are talking about laying off. Oops, poor network. Hold on. I did see something unfortunate about the fact that BA were planning on laying off like 14,000 people or whatever, which is obviously horrendous. I think we need to be mindful of the fact that the economy has taken a battering. The economy has essentially been switched off overnight. And we need to think about what kind of society we want to live in after this, right? So, yes, let's get through it. Let's survive, which I think is really important. And to do that, you can take practical steps when you go out safely. Wear appropriate clothing as much as you can. Start wearing masks or cloth face coverings if you can. The reason that hasn't been government advice, I would suggest, is because there was concerns about the supply of face masks and PPE for NHS workers. On that point, though, interestingly, on the back of the Daily Star, which I haven't read, I just looked at it. I bought it, unfortunately, but I looked at it, and they're saying football docs kicking off over the fact that Premier League footballers are going to be, apparently 1,000 Premier League footballers, they want them tested once a week so they can keep on playing. And doctors working in football are concerned that that's going to take away from testing capacity from the NHS staff front line that need it. So I don't know what's happened in the press conferences for the last few days, because I can be across this by buying the papers, by reading them, and dipping in and out of media as I need it, right? So I would really suggest that you guys do that as well, because the negative mental health aspect of this constant 24/7 diet of bad news is going to be significant. It's going to get worse over the next 10 days because of the weather in the UK, and that's why my output is increasing during this period, because it's a time when it's needed. My final point wrapping up is the chap that was on the video yesterday that I did, who was homeless in Watford, in Canterbury Park, lying there, is still very much homeless, lying there in Canterbury Park for the second day running. Unfortunately for the council, that video has gone to 10,000 people, which is not bad. Thank you very much for sharing. Keep sharing it, though. Keep letting people know. I know they said that they would send somebody out, apparently, but he's still there. We have raised £400 odd for adverts, which I said that I would post a GoFundMe link in the video yesterday. I didn't quite get round to it because I've got a full-time job, and I will kind of do this. I will add the GoFundMe link, but just to let you know, we are crowdfunding for Facebook ads. I'm fully registered in terms of being able to run political ads as well. I'll try my best not to, but if we need to, we will. And also, this is clearly a political issue because it's about allocation of resources, right, in terms of healthcare and what kind of society we want to live in. So we will run those adverts. We will do that. I will post the GoFundMe link in the video description. If you would like to click on it and you'd like to contribute to it, please do. Your money hasn't been spent yet. I still owe Facebook $46. I still haven't paid them for some ads that I tested. So we've got about 50 odd pounds that we will use just for Facebook ads to get this content to more people. At the moment, there is no need to do it because we've managed to get our content to 1 million people organically. That's just through you guys liking, sharing, and commenting. So thank you so much for your time. Thank you for spending half an hour or so with me this evening and listening and watching. I hope it's provided some food for thought, and I've seen a comment say it's scary but overwhelming, bad news causing anxiety. I completely agree, Tony, and that's why I want to make sure that this content is, well, caring, compassionate, balanced, and doesn't cause more harm than good. So thank you very much for watching. I really appreciate your time. Look after yourselves and each other, and no doubt I will see you really, really soon. Thank you.